Hello, everyone. For anyone who hasn't yet met me either in person or online, I'm David Stout, the Chief Executive. This is our latest video briefing. This time I'm in the office, but Chris Hudson isn't, so Chris is still dialing in the questions on the phone. So thank you again for submitting questions. We've had another group today, so Chris, over to you to start with the first question.
Okay, thanks very much, David. And our first question today comes from one of our community nurses, and they were particularly keen to know how we go about finding out the number of patients in care homes or supported living settings with coronavirus. They say they realise those homes are not under Shropcom as such, but as community nurses, they visit patients in these settings on a daily basis, so feel it's a relevant issue.
Yeah, no, it's a very relevant and very topical issue, actually. So there's been a lot of work going on in relation to care homes over the last few days. So the coordination of this is through the two local authorities. So they do monitor the number of cases in care homes and outbreaks beyond single cases. So there is data on that, and that will feed in as we work through our work on the care pathway from hospitals to care homes, and what the role of community support is and multidisciplinary support to care homes is. So it's a really live topic we're working on right now. So by next week, I'm hoping we'll have a first version of how exactly we operationalise the support to care homes. So I think we'll come back to this again, but thank you for raising it, and as I say, really important. In terms of PPE for care homes, as a related point, again, the coordination of that is through the two local authorities, but we're very much working as a system on this. So the NHS supplies and the local authority supplies, they are supplied separately. We're working together on a system of mutual aid, so if one of us is short, then we can share equipment between the health and the care sector. So again, really important work. So yes, let's come back to this as the picture clarifies, but we will make sure that we do communicate where there are outbreaks and make sure the right support's in place.
Thank you very much. Well, from that on testing in care homes, I suppose, we're to a couple of questions we've had related to testing our staff again. So first of all, somebody who says they've been off work with COVID symptoms recently, they're back now. They say, if we eventually get an antibody test, will Shropcom be offering this to its staff so we can know whether they've had coronavirus or not and are now immune?
Yes, so as people may well know, the work nationally is happening right now on antibody tests. So the point of those are they will be able to test whether someone has had COVID-19 in the past, as opposed to do they currently have COVID-19. So those tests have not yet been developed. So there are test versions, but they haven't been proven to be adequately accurate yet. So I think there's an awful lot of work going on nationally to get us to the point we do have a usable test. And at that point, I don't know, but I very much imagine, rather as with testing generally, that the first port of call for that will be NHS staff, because obviously, if we are confident that people who have had COVID-19 already have a degree of immunity to it, then that will be really important for getting people back to work and able to operate confidently, safely in their day-to-day jobs. So firstly, we don't know when it will be ready, but we are optimistic there will be an antibody test in the hopefully reasonably near future. And secondly, yes, I think as soon as we know that, I'm sure there will be plans for how we roll it out to NHS staff generally and Shropcom staff in particular.
Thank you. And related to current staff testing, a question here about capacity and making the point that while we apparently have the capacity to cope right now that the testing's being rolled out to cover care homes and possibly other emergency providers too, is there any concern there that we have the capacity to cope with that?
Again, that's very much live work at the moment. So the question's right. We do definitely have capacity at the moment. So we have more capacity in place than the number of tests we are actually doing. So there is definitely spare capacity right now. But as the question suggests, we are rolling out that availability of testing considerably beyond healthcare and social care staff members through to other key workers such as the police and so on. So we're modelling that right now. So we are looking at the the likely demand we're going to face from those wider staff groups over the next few weeks and months, and matching that against our current capacity. There are new plans emerging all the time for how that capacity will be increased, and again, people will be familiar with the government's pledge to increase testing capacity to 100,000 a day. We're still some way below that as I speak, but clearly there are plans to increase the overall capacity across the country, and again, I'm sure we will have availability for that capacity locally here in Shropshire as well. So right now, capacity is fine. We are modelling how much the demand might grow, and there are new opportunities for testing capacity being put in by the day almost.
Thank you very much. Can I move you on to talk about PPE now, please? And we've just had a question related to PPE saying that it's been in the news that there's shortages all over the country, and yet we keep being told that there's no particular shortages here at Shropshire Community Health. I suppose the question is, why is that? What's the difference between us and what we're hearing elsewhere? And just reassuring really that the information they're being told locally is correct.
So the information is correct. So to date, we have managed to have sufficient equipment for everyone who needs it within the community trust and generally within the system. Where there are difficulties, it tends to be on the care home and domiciliary care side rather than the health side. But that said, it is a less robust distribution system than we'd like. So with a small subset of the overall PPE, there are definitely national shortages and what they're calling just-in-time delivery. So in other words, you get down to quite a low capacity before you get your next delivery of stock. And this is particularly around gowns, to some extent swabs. Now, by and large, in Shropcom, we are relatively low users of the items that are in scarce supply. So in many ways, we're not in the front line of where shortages would be felt if there were shortages. But we are managing it well. I went in, I had a look myself to our stock room in William Farr House earlier this week to see how we're managing the supply and the distribution of the equipment that we've got. And from a standing start, we've now got quite a slick system in place. So we're certainly not complacent. We absolutely need to keep on top of this. If any member of staff feels they're not getting access to the equipment they need, they absolutely do need to flag that with their line manager and make sure we're aware of it and can do something about it. But touch wood, to date we have managed, not comfortably, but we have managed within the supply that we've received to be able to make sure everybody has the equipment they need.
Thank you very much. The next area of coverage is just about service change and being asked the urgent care changes at Whitchurch and Bridge North, and just being asked how they're working and do we expect those to be temporary or could they become permanent in the future?
So these changes, they are definitely temporary by nature. So they've been introduced for a couple of reasons. So firstly, because we were worried locally and nationally indeed that there may be some people who are simply avoiding going to A&E departments because they're so worried that they might either put themselves at risk or indeed they might take the time of very busy health professionals, and for both those reasons there may be people who could be treated now who are not getting access to treatment. So the idea of the transfer of the urgent treatment and minor injury service out of the A&E departments to work alongside our MIUs is to try and address that worry that people may be not presenting who should be. And in terms of, and secondly, if there is increased demand, and right now there isn't, has to be said, but if there became a new wave of demand within the A&E departments, clearing the capacity to be able to respond quickly to that would be extremely beneficial as well. So that's the secondary reason. So far, I mean, we're kind of a week in or so. All the information I'm getting fed back is it's working pretty well. It's the hospital services and our existing MIU services, the teams are working together well. The level of demand isn't particularly high. It's sort of back to normal levels, if you like. So we found our MIU activity had started to fall in the last 3 or 4 weeks as the pandemic rolled out. So rather like A&E demand falling, it looks like demand is rising back towards normal levels. It is definitely a temporary change, but clearly, like with many things, we'll want to see what works well and whether there are any lessons we want to pick up from how this is operating in this period to see if there's any elements of this we would want to retain. But that would involve a kind of a whole series of processes like public consultation and so on you'd have to go through. So for now, it's a temporary change, but let's see what works and let's learn from it.
Thank you very much. And that last aspect takes us on to our last question, really, which is about looking to the future. And so there's some suggestions that we may have already hit the peak of COVID-19, and if that's the case, are we already starting to think about the plan for getting back towards normal business in a few months?
Yeah, so there is some evidence that what you might call the first peak has been hit. Now, it's early days, and we certainly shouldn't take any of this for granted, but it does seem like the impact of the government's advice to stay at home and self-isolate and social distance has had a positive effect. So the peak we had anticipated has definitely not happened, and the projections are a much flatter plateau of activity. That said, there is understandable concern and at national and indeed local level that if we lifted those restrictions too early, that there could easily be a second peak which exceeds this first peak. That, in other words, the virus would start spreading again, and that demands on healthcare would suddenly rocket up. So we are at national level and locally being cautious about this in terms of what we do next. But yes, we are starting to plan what we're calling kind of recovery and restoration. So what services, we're reviewing what services we suspended that potentially we could reinstate. And kind of the restoration bit is where might we land the new models of delivery? So are there things, the question we're asking ourselves is, are there ways of working that we've brought into place because of a coronavirus crisis that we'd want to continue? So most obviously use of technology and so on, but there may be many other lessons around how we've worked together to speed up discharge from hospital and that sort of thing. So that's the next phase of work, is to start to think about those questions in a lot more depth. We need to be careful, not least because of the potential for the transmission to suddenly start rising again, that's already mentioned. But also if we start to bring back elective care, we've pretty much stopped elective care at the moment. Obviously that's important because there will be people who are not getting treatment who would normally have had operations by now. But we need to plan for the impact of that on our capacity as well. So as well as the fact that the COVID transmission could start rising again if we're not very careful. If we bring back services too quickly, we may simply not have the staffing and physical capacity to deliver services safely. So the short answer is we are starting to have that discussion around what does come next and at what speed do we bring things back, and what patterns of service delivery do we want to have as a new normal, which are different from how we always used to operate in the past.
That's great. David, thank you very much. That brings us to the end of the questions we've had today. Before we close, I'm sure you'd like to just say a few final words. Yeah,
so sort of as the last question was implying, it feels like we've kind of stabilised for the time being in terms of how we're operating. I think people have really blossomed in terms of how we've responded to this, and I'm getting lots of positive feedback from partners across health and care in terms of how they are working with Shropcom staff, with our staff as partners, and how well we're working. Lots of praise for our testing teams who are stepping up to increase our capacity and bring that staff testing we talked about earlier in at pace, and so on. So I'm think we've done really well in this period to date. I think the next challenge will be how we respond as we enter that recovery phase. So I'm sure everyone will bring that same spirit of endeavour and teamwork and so on into that as we have into this early phase. So I think I look forward to the innovation and ideas that people will bring to the table in relation to that. So as ever, thank you all for what you do, and thank you. Not when I say all, I mean all. So not just our clinical frontline staff who are doing a fantastic job, but all of our support staff, all of our admin staff as well. It really is a team effort. So thank you once again, and let's keep talking, and absolutely keep submitting questions that you've got.